Welcome to the Advanced Skincare Institute. I'm Dr. O.J. Rustad. I will be discussing liposuction. Hopefully this tape will answer any questions you might have about this procedure. If you still have questions about liposuction, please feel free to ask one of our ASCI staff. Liposuction was developed in France. It was introduced to the United States in 1982. Since that time, there have been many improvements in the procedure which have made it safer and more effective. Liposuction is a technique used to remove areas of localized fat that have resisted shrinkage by diet and exercise. The most common areas that are treated are the neck, abdomen, sides, hips, buttocks, and thighs. Other treatable sites include arms, knees, and ankles. Liposuction is not a means of weight loss. The amount of fat removed may only weigh a few pounds. Liposuction is a means to reshape and contour the body. Liposuction does not improve the appearance of cellulite, and in some cases it may appear to make it worse. The results of liposuction are thought to be permanent. It is believed that we are born with only a certain number of fat cells. When those fat cells are removed, they do not regrow. However, the remaining fat cells can enlarge if a person does not continue to exercise and watch their diet. To determine if you are a candidate for this procedure, you will first consult with the surgeon to discuss the procedure and determine if the improvement you desire can be achieved. You will read and understand information on this procedure and have a series of photographs taken of the body sites to be treated. A preoperative history and physical needs to be performed by your primary care physician, and you will have blood tests done. Once this has been completed and you are found to be fit for surgery, the liposuction can be scheduled for you. Liposuction can be performed safely with good results. However, as with any surgical procedure, there are possible complications. Usually after liposuction there is mild or moderate discomfort, swelling, bruising, and temporary numbness or increased sensitivity in the surgical areas, which may last several days to weeks. For several days there will be bleeding and oozing from the incision sites. You will wear a tight dressing and garment to minimize these expected problems. Uncommon problems include dizziness, breast enlargement, irregularity of the skin surface or color, infection, nerve damage, development of trapped blood or fluid under the skin, and sagging skin. If sagging skin occurs, a second operation to remove it may be required. Additional risks are associated with the use of anesthesia. These include an allergic or toxic reaction to the anesthetic, heart or breathing problems, nerve damage, and rarely death. Let me explain and show you the procedure in more detail as it has been performed on one of our patients. On the day of surgery, you will need to be driven to the office and home again. Once at the office, any question you have will be answered. You will then be taken to the operating suite. The areas you want treated are confirmed with you. The areas to be treated are evaluated with the pinch test. By pinching the fat between the fingers, the amount of fat can be determined at various locations. These areas of excess fat are then marked. These markings help remind us during surgery of the locations from where the fat needs to be removed, as well as the areas to avoid. Any non-symmetrical area of fat deposits are noted and marked. For example, this patient has a greater fat deposit on her left lower back than on her right. The incision sites are marked. This marking process is repeated on the other side. A shot to help for pain is given. Most people don't require heavy sedation or general anesthesia. Lying on the operating room table, your incision sites are anesthetized. These are the sites through which the anesthetic will be given and fat removed. Next, your skin will be cleaned with an antiseptic solution, and you will be draped with sterile towels. The operating staff will be wearing protective caps, masks, eyewear, and sterile gowns and gloves. Small, about a half-inch incisions are made at the previously anesthetized areas. The local anesthetic is then slowly infiltrated into the areas to be treated. There is usually some moderate discomfort and a cool sensation as the anesthetic numbs up the skin and fat. It can take 10 to 15 minutes for each site that is anesthetized. Once the skin is well anesthetized, the liposuction cannulas are inserted under the skin. Fat is then removed by aspiration. The cannula is moved in and out multiple times to loosen and remove the unwanted fat. It can take 15 to 20 minutes to remove the fat from each area. The tip of the cannula is closely watched to minimize injury to muscles or internal organs. There will be a strange sensation of the cannula under the skin. There may be a pinching type of feeling, but usually not significant pain. This process is continued until the desired thickness of the fat is achieved. Multiple areas can be treated at one time, such as abdomen, hips, buttocks, and back. This is how our patient looked right after surgery. You can see she is slightly bruised, but it is already evident that there's much less fat under the skin than before the surgery. You can see the small incision sites are discreetly placed. She already has a much flatter stomach and more shapely hips and buttocks. She felt good and was able to stand, walk, and talk without difficulty. A pressure dressing and garment are placed over the treated areas. These are left in place 24 hours a day for several days. Only the outer pressure garment is removed for bathing. Normal activities may be resumed from 2 to 7 days after the surgery, depending on the size and number of areas treated. This is how our liposuction patient appears 2 months after the procedure. You can see there's no evidence of bruising and the swelling is gone. She fits better in clothes, including a bathing suit.